So my name is Bill Boysenalt. I am a physical therapist from here in the United States, and I'm very excited for my upcoming visit to Peru and have a chance to work with Peruvian physical therapists in January of 2019. The topic relates to medical screening and first contact or direct access to physical therapist services. And again, I'm very excited to have this opportunity. It's an important topic. Many patients that we see have already seen a medical doctor, whether it was recent or in the past, but medical disease can have its own schedule or timetable in terms of when it's going to present. So it is important that physical therapists, as part of the diagnostic process, are medically screening patients to help identify those patients who need to return back to their medical doctor. The differential diagnosis is a process and is a result of our examination, the examination of our patients. The classic medical model typically does not provide enough information to allow me to develop an individualized treatment program for patients. Low back pain is a common diagnosis. Multiple sclerosis is a common diagnosis. That doesn't provide me guidance. So my examination scheme will result in a diagnosis that is complementary to the diagnosis that has been established by the medical doctor. Now, as I said, whether the patient has seen a medical doctor first or not doesn't change my responsibility. And again, in part that relates to disease has its own schedule of when it's going to show up clinically. So if a patient has seen a medical doctor 1 week ago, now they're coming in to see me, things can change drastically. And patients don't always go back and contact their medical doctor. So it is imperative that physical therapists are medically screening patients, every patient they see, to be able to answer a baseline question: is physical therapy appropriate at this time or not? And there are many examples in the literature of patients coming to see a physical therapist. Physical therapist does the examination, identifies red flags or warning signs, and then communicates with the medical doctor and facilitates the patient going back to the medical doctor to get their appropriate care. So that is all part of the differential diagnostic process from a physical therapist perspective and how it complements what a medical doctor does. I am very excited about having an opportunity to come in and to work with physical therapists in Peru. I'm looking forward to learning a lot about the culture and practice in Peru. And I look forward to sharing what I've learned over 40 years of practice and education.